Hi everybody, I'm really sorry for the delay in this webinar. We're having lots of technical difficulties in inviting in our guest speakers into our presentation. So what we're going to do is we're going to make a start because you've all taken the time out today to be here. And our first guest speaker is with us, and in the background we're going to be trying to desperately get our other guest speakers in. If we can't for whatever reason, we will have to look at probably rescheduling this webinar to another date where hopefully you'll all be able to attend, and we will ensure that we kind of get the guest speakers in on that date. So welcome everybody to our Walsall Safeguarding Partnership webinar on self-neglect. My name is Kellyanne Perry and I'm the Interim Practice Improvement Lead for the Safeguarding Partnership. And over the last 10 weeks, we've all had to make some significant changes to the way we live and how we do our job when working with adults, children and their families. And in our weekly communication with our partners, one of the issues that has risen is around self-neglect and the lack of referrals to the self-neglect panel, which you'll hear Seanna talking about in a short while. Self-neglect is a key priority within Walsall, and although we are talking about self-neglect today, this isn't the training, and there is training around this subject which can be found on the Walsall Safeguarding Partnership, which we will give you the link to that at the end of this presentation. And it's so lovely to see so many here today. We've got people from lots of different agencies. We've got 66 people currently with us, from both adults and children's, which is really lovely. And if you work with adults, then you will have that understanding of self-neglect and hoarding already probably. And if you work with children, then you're also having lots of contact with adults who are part of that child's life. So it's really important that we have that think family, a whole family approach agenda in our minds, whether you're working with adults and children, and having the understanding of self-neglect, and more importantly where you can access the appropriate service if you identify somebody. So what we'd like to do, hopefully in the next hour, if we do get our guests on board with us, is to have a think about how we can support people who neglect themselves and to get a better understanding of what services and where we can make referrals to, especially in light of COVID-19 and social distancing. So what services that are, that professionals are still able to provide. So in the next 45 minutes to an hour, you won't be hearing from me. You'll be hearing from some of our important partners from across Walsall who will be providing support for self-neglect now. So you'll hear from Seanna Lassetter, who is from Adult Social Care, and Seanna is definitely here with us today and she'll be our first guest speaker. And then we're hoping, if not today, then when we reschedule, that you will hear from Melanie Grainger, who is from West Midlands Fire Service. We've also invited Connie Jennings from WHG and Sharon Latham from Dudley and Walsall Mental Health. And they're going to share with us some of their reflections, some key messages and the current response around self-neglect. So we're hoping by the end of this session you'll feel equipped and you have the right information to help spread any key messages in your organisations, and that you've had some time to reflect either within your role or even maybe within your community around people that may need some additional support and where you can access that support. Before I hand over to Seanna, even though we can't see you or hear you, you can interact with us today as part of the webinar by posting your questions, answers or comments in the Q&A box. And we'll be picking these up at the end of today's session. So without further ado, I would like to hand you over to Seanna from Adult Social Care.
Hi everyone, sorry for the delay, as Kellyanne said. My name's Seanna Lassetter. I'm Principal Social Worker in Adult Social Care in Walsall, and it's my privilege really to meet with you all today. I wish I could see your faces, but we can't do that right now, can we? And just to kind of highlight this particular issue, which has been, as Kellyanne says, really on the agenda for the partnership, and as I've gathered with colleagues sort of on a weekly basis, we've been very mindful of the neglect and abuse that we're not seeing right now because of lockdown. And this is really why we just wanted to take the opportunity to kind of look at some of the things that are going on in relation to self-neglect right now. So if Kellyanne could move the slides on, I've got a picture for you.
Kerry, have you got control of that? Sorry. This is our first webinar that we've done through the Safeguarding Partnership, and we've got Kerry Lister here with us, who's helping us with our IT. But for some reason today, we've done a few of the webinars and they've worked really well, but for some reason today this one isn't working. But I can see now that it is, so I'll leave you in Kerry's capable hands.
Right, okay, so if we can have the next slide. Hopefully you can see that. It's just the picture, it's just the Google image, it's not anywhere in particular, but it's just really to ask the question, what is it that you see? Who do you think lives in a house like this? And who's actually seeing this right now? Because we're all in lockdown, we're all not going out and about as we were. Certainly in terms of social workers, we are only visiting people and if it's absolutely necessary, and all those visits are risk assessed. So there's a lot of things that we're not seeing right now. And I just really wanted to kind of make the point that we all have certain living standards, we all have certain ways that we choose to live and things that are acceptable to us or not acceptable. And it's very easy to judge people, isn't it? So just sort of think, well, what are you thinking when you see this image? And how do you think we as a partnership in terms of working together to support people should respond to this kind of scenario? And next slide. You may not be able to read this very clearly, but there is a link at the end of my slides where you can find this leaflet. It has been produced by the Safeguarding Partnership. And I just wanted to really be very clear. Well, what are we talking about when we're talking about self-neglect? And what you'll see in the blue bit of that flyer is it's defined as a refusal or inability to cater for basic needs, including personal hygiene and appropriate clothing. So we're talking about self-care there. There's an issue sometimes for some people around not seeking the medical assistance that they need, and that can be for a number of reasons. And as we've just seen in the photo, it can also be around people's living conditions and rubbish accumulating. And sometimes we talk about hoarding. And of course, hoarding disorder is a mental disorder as defined now. And those of you that will have seen some of the TV programs around that, that can have a real impact on the way people can move around their property and access the bathroom, the bedroom, etc. And there's lots of kind of research that's been going on around that. And then the last sort of thing highlighted there is around collecting, and these things can be stored. I don't know if any of you on the webinar today have ever been in a hoarded property, but it can feel quite claustrophobic when you arrive. For obvious reasons. So what we are starting to explore today really is that self-neglect can be an issue for anybody, and it can result from experiences around mental ill health or physical ill health, and it can impact the way that you're able to look after yourself. Now, if you don't live on your own, of course, that can impact others, and we will be kind of looking at that as well. Hopefully, Mally's going to join us shortly from the fire service, and she'll be talking about the ways that they're trying to support people right now who may be self-neglecting. So if we move on to the next slide. When I spoke to some of the partners, they were really keen that from an adult social care perspective that I just highlighted some of the legislative framework that we work in, because it is very different to children's services, and sometimes there is a sense of frustration about what can you do, what can't you do. So just really wanted to introduce you all today to some of the key legislation that in adult social care we have to adhere to and informs our making. Now, all of adult social care legislation is underpinned by the Human Rights Act, And if you look at Article 8, I mean, it's not on the slide, so if you're trying to follow it, Article 8 of the Human Rights Act is the right to respect for private and family life. And what it says within that is that the key reason for that article is that it's to protect people from intrusions by agents of the state, unless it's for a good reason. So I think it's really important to recognise that when we are wanting to interfere, for want of a better word, in people's lives and potentially make judgments about their living conditions or how they're looking after themselves, that there's this real value base in the Human Rights Act, which means that we should respect people's right to privacy. Okay, so going on to the Care Act, the slides, there are kind of two key sections of, sorry, previous slide, which we look at in adult social care in terms of our legal duties. Now, the first one is section 9, and that's in relation to a needs assessment. So if somebody has care and support needs, and that may be as a result of physical ill health or mental ill health, then we as a local authority have a duty to assess those needs. And we have a duty to work with that individual to see what they want to achieve in terms of their day-to-day life. What outcomes do they want? It's very person-centred and aligns to a lot of practice across the partnership in different roles that people have. And the second one is our section 42 duty there on the slide, and that's our safeguarding duties. So when we're thinking about whether somebody needs protection from abuse or neglect, and that could include self-neglect, what we're thinking about is, do they have care and support needs? Are they experiencing or at risk of abuse or neglect? And as a result of those care and support needs, are they unable to protect themselves? So if you start to think about that, it's an introduction. We're not going to be able to unpack it all today. That's really our starting point in adult social care. You know, what is it that the individual wants? And many of you will have heard of the phrase making safeguarding personal. And again, in terms of our section 42 duties, it's very person-centred, very much working with people, not doing things to people, to actually hear about their experience and support them to have the outcomes that they want. Okay, so the next slide is around the Mental Capacity Act. So this is a piece of legislation that gives people rights, and it really links with the Human Rights Act, which I mentioned right at the beginning. Now, the Mental Capacity Act has a set of principles, and I'm not going to, again, all the details around this, but just wanted to highlight the 5 principles of the Mental Capacity Act. Now, we always have to firstly presume that somebody has the capacity. And what it says on the slide there is, start by thinking I can make a decision. So that's really important starting point, and it goes back to what I was saying about sometimes we can be really quick to judge. So let's presume that people have capacity in the first instance. Then the next principle is around maximising people's capacity and helping people make decisions. So that would be around having an honest conversation about what you as a professional or neighbour or friend or family member may be worried about. And thirdly, it's about recognising that people have a right to make unwise decisions. And just because you make an unwise decision doesn't mean that you lack capacity. So people have a right to choose to live in a way that they choose to live. But it's really important as professionals that we have those honest conversations about the decisions that people are making that have an impact on their own well-being and potentially on the well-being of others. Thirdly, we always need to think about best interests, and any decision made needs to be in somebody's best interests. And there's particular ways, if you look at the legislation, that we can demonstrate that. And the last principle is around least restrictive. We must always consider the least restrictive option when we're working with people. So that's just a real whistle-stop tour in terms of the Mental Capacity Act. And I also wanted to mention in terms of the next slide around the Mental Health Act. Again, this is a very brief introduction, but it's very, very much a last resort in terms of working with people who self-neglect. And to just give you an example, you know, I am an approved mental health professional, so I work with the Mental Health Act. We had a referral last week around a 93-year-old who lives in Walsall, and things were not going very well for her. There were kind of feces around the property. She was struggling to look after her personal care. She wasn't eating and drinking. She was actually getting quite a package of care in terms of support. She had family members supporting her. But it became very evident that her mental health was really deteriorating, and she actually needed a period in hospital. So this is when we started to think about the Mental Health Act and how that could be used.
Hello, I'm sorry, but the person you've called is not available. Please leave your message after the tone. After you've finished your message, just hang up. Or to hear more options,
some
please press
interference
1.
there. I don't know if you can hear that, but I just was hearing something else. So just to be clear, that in terms of Mental Health Act assessment, that involves 3 people. And that's an approved mental health professional, which is quite often a social worker, but not always. A doctor who has special training in mental disorder, who's called a Section 12 doctor, and another doctor. So there does need to be 3 professionals involved in that assessment, but it's very, very much a last resort in terms of working with people who self-neglect. So moving on to the next slide. I just wanted to obviously give you our contact details in terms of adult social care, but I just wanted to highlight as well in terms of the slide with the leaflet on. We won't go back to it, but I'm just referencing it because what it says on there is if you believe the adult has care and support needs and can't protect themselves, call Adults Access Team. There are a number of things that you would want to consider before contacting adult social care. So they may include involving the GP or the district nurse. They may involve the local fire service, and hopefully Mel will be able to join us and tell you how the fire service can support around sort of risk assessments and supporting people to live safely. There's a link on that leaflet to Age UK, to One Walsall, and to a social enterprise called Clouds End that are specialists in terms of hoarding. So there's a number of organisations locally that you can connect with as a practitioner, where they can offer you advice and support. So it won't always be the right thing to do to contact adult social care. Now in Walsall we do have the multi-agency self-neglect panel, which Kellyanne referenced. Now as she mentioned, we have been getting less referrals to that panel, which might be because actually single agencies are really understanding this issue, working with the person and making the necessary interventions really in terms of supporting that individual. But there may also be times where a multi-agency discussion would be really helpful. And this is what we want to encourage as a partnership. And if you click on the Here bit, you will all get these slides. It will take you to the Safeguarding Partnership website, and it will talk you through the referral route, and there is particular guidance there that you may want to consider as well. I mean, what I've put on the slide here is kind of 4 kind of key things for me, really, in terms of working with people who self-neglect. And as I've kind of said right at the beginning, it's really important not to judge people. We don't know their story. We don't know, you know, why self-neglect may be an issue for them. There may have been loss, bereavement, mental health challenges, all kinds of things that can impact on somebody's well-being. So it's really important to hear people's stories and to build a relationship with that individual. In terms of the pathway and working with people who self-neglect, we must always seek consent and have those honest conversations about some of those risks that we might be identifying as practitioners. I've mentioned safeguarding personal. It is about recognising that people have a right to self-determination, and they have a right to kind of set their own outcomes. It's about working with, not doing to. And there's a mention there, obviously, in relation to the Mental Capacity Act there, that we need to, have those conversations where we're maximising people's capacity to engage in any decisions that may reduce the risk that they might be facing at that time. And if we go to the next slide, that's just really taken from the pathway guidance. I've just pulled that directly from there, and I recognise that some of you today are predominantly working with children, and it's just about being really clear that if you identify a child where you're concerned about an adult self-neglect, then you really should be referring that to MASH, and the phone number is there. And if you go to the partnership website, there's more information around how to refer in. And in terms of the adult, these are just a few more pointers in addition to what I've already mentioned, that you might think that an adult that you've come across is actually in immediate danger. And so it may be appropriate to contact emergency services. If that's not the case, then it's really important that you have a conversation about your concerns and get their views about those concerns. It's very easy to misinterpret what's going on and make judgments, as I said. Now, after that conversation, if you are still concerned, you obviously need to consider what the person wants, but also think about whether there is any evidence around mental illness or concerns around mental capacity, where you may need to think about the Mental Capacity Act and what that means for the decision making that's going on for that individual. Risk is obviously something that we need to think about, and with the tool that sits alongside this multi-agency pathway is a really explicit way of assessing risk, and it uses something called the clutter rating scale. And there's actually a photograph of rooms, a bit like the room I showed you right at the beginning, because we can all have a judgment, and it is going to be subjective, but there's a scale there to kind of measure, how cluttered a property might be, and therefore what the risk might be. So I guess lastly, what I would say is that we always try and seek somebody's consent and work with somebody, but there are going to be times where you believe that the risks are too high, and you would need to be thinking about overriding that consent and having that conversation with other practitioners who might be able to explore some of those risks with you. And also recognising, that some people who are experiencing coercion as well, and somebody else may be in the background influencing their decision making around sort of refusal of support. So it's really important to understand the individual circumstances and sometimes ask those difficult questions. So that's sort of by way of introduction there. Probably raised more questions than given answers, but I shall hand back to Kellyanne now. Thank you.
Thank you for that, Seanna. We haven't had many questions specifically within the chat. We will send you the slides out, obviously, from what Seanna has just spoke about. If we can get the other presenters in a moment, we're going to try dialing them in, then we will send those out to you as well. Kerry, can we see if we can contact Mel then in the first instance for the fire service? We tried to do it when we were live, but her voicemail came up, and I think, well, we heard it, so I don't know whether everybody else actually heard that. So we're just trying again now to see if we can get Mel.
Melanie Grainger.
Hi Mel, it's Kellyanne, you okay?
Oh, hi, are you all right? I don't know what's
Yes,
going
thank
on.
you. No, you're live. You're live on the event now, Mel. We've had to dial into you because for whatever
Okay.
reason we can't get you in. So everybody can see your presentation. So if
Okay.
you just want to talk through it and just as you would normally on the live event, we just can't see your lovely face, unfortunately.
Never mind. Okay. Right, okay, I haven't got the slides in front of me either. Sorry, I was able to see the presentation up to now, but it's just kind of crashed, so I can't see either. So apologies. I will do my best to run through what's in them. I might need to answer questions offline afterwards. So, hello everybody, my name's Melanie Grainger. I am a Partnership Support Officer for West Midlands Fire Service. On the first slide there, I've just put the contact details for myself and my colleague Julie Wimpany, who also covers, so we both cover Walsall and Wolverhampton. And I'm just going to kind of talk you through our sort of perspective around self-neglect, particularly in the current COVID-19 situation, and what we're able to do to try and support and assist. Okay, so if we move on to slide 2, basically this is just talking about sort of what we're seeing at the moment. So our safe and well visits in terms of home visits have reduced quite dramatically because of social distancing and all of the other measures that we've had to put in place. And the kind of the balance of risk between going into people's homes and the potential to spread the virus weighed up against the risk of fire occurring. And because fires are thankfully quite rare, the risk of spreading the virus, particularly at the beginning of the pandemic, was seen as higher than than the risk of fire. So we did scale back in terms of our home visits. That said, we are still delivering home visits to some people, and I will come on to that in a moment. But what we're seeing is that both for our service and across the board with other providers, the opportunities to spot self-neglect in the usual ways have reduced because we're not doing home visits. We're not getting the opportunity to see that home environment as frequently as we normally would. And what that means is that potentially situations are escalating, situations are changing, and we've not kind of got a way of being aware of that at the moment. We've seen referrals for safe and well visits. That was as expected, partly I think because professionals are not out and about as much as they were, and partly because of the obviously the response to the pandemic, which has meant that people are have been busy having to kind of divert resources elsewhere.
We haven't had many questions, particularly within the chat. We will send you the slides out on what Seanna has just about. If we can get the other presenters.
Sorry, I think that's some feedback. Mel, are you still there?
I'm still here. I was just trying to. I was just talking through the slides.
Yeah, sorry, that's not me speaking live now. I said that about 10 minutes ago. So I don't know whether you've got your computer on and it's some feedback or whether it's coming through your phone.
No, my computer's kind of been on hold.
Okay, just keep talking through. We can still hear you and we can still see the slides that you're speaking about. I think something must be on a complete delay. So I don't know whether you want to turn your computer off if you can.
I'm going to just mute the sound off my computer. Sorry, hang on. Right, okay. So what I'm seeing on my screen now looks as though it's about 5 minutes previous.
Yeah, I think you're on a delay. So sorry about that.
Okay. Right, no idea why that is. Apologies. Where were we up to? We were up to. Did you all hear that bit that I was just talking about? Sorry.
We did. I think you just continue. Yeah.
Okay, so we were on the second slide, and I was explaining about the reasons for reductions in referrals for the safe and well visits. So partly because of how busy people have been trying to respond to the pandemic, obviously, and partly because they're getting less opportunities, I would suspect, to spot the sorts of issues that we would normally say make the referrals to us. We have also seen an increase in fire incidents at the same time, which was very much as expected. We know that when people spend more time at home, they have more fires. We know that the current situation is causing mental health issues. People are not sleeping as well. So again, that is bound to cause an increase in incidents, and we're also seeing an increase in fly tipping of rubbish and so on, and having a lot more outdoor fires, and it's not just garden fires, it's refuse as well. So that picture there was a fire from which was property. In terms of so if we move on to the next slide there. So in terms of changes to our services and the support that's available through the fire service, I'm kind of assuming that most people are aware of what our usual safe and well visits entail. So I've not kind of gone into that in too much depth. Basically, we do the home visit, which is around assessing risk to fire and other dangers around people's properties, and we provide equipment to make them as safe as we possibly can. We provide advice and guidance around escape routes, escape planning, how to prevent fires from starting, all of those sorts of things, and we make onward referrals to other agencies. So we very much encourage sort of positive changes around lifestyle, which we know can reduce risks of fire. What has changed, because we are obviously in the position that we're in terms of the pandemic, is that we have introduced what's called remote safe and well. So for people who we believe are at lower risk from fire, those who have less of the risk factors when we receive the referrals, we're starting off the safe and well visit over the phone using an app called 999i, which enables us to have the conversation with the person over the telephone. They're able to show us any particular areas of concern around their property. We test the smoke alarms over the phone and so on. And we can send out equipment remotely if necessary. So those are the kind of first port of call. However, we are still carrying out home visits for people who are at higher risk. So that somebody who's living alone and has other risk factors. So potentially, if they're smoking, if they have got poor mobility, if they've got mental health issues, if they've got dementia, if they're hoarding, if they've got any kind of difficulties escaping, those sorts of things. So we are still doing home visits for those people, and taking all of the kind of appropriate measures to try to reduce risk in terms of, so we're wearing PPE to go into people's properties, distancing as much as we can when we're there and so on. But those visits haven't stopped, and I think that's quite a key message from us really, is that we are still open for business and we are still able to go and visit and provide support where necessary. We also have a team of complex needs officers who will support with the more complex cases, and the sort of self-neglect cases tend to fall into this category. It tends to be people who require, rather than a single one-off visit, and we're able to resolve the risks and the issues. Very often people who are self-neglecting will require more of a long-term kind of intervention to build trust, to build relationships and so on. So our complex needs officers are still out and about. They're keeping in touch with people by telephone, but are also able to deliver home visits and so on. What I would say, and what we've started to see in some cases, is that the safe and well visits and the complex needs officers are not really a mechanism for welfare checks. So in order for us to do a safe and well visit, it really needs to be to address some sort of risk of fire, and that's what the complex needs officers' roles are about, really. We're not able to just provide a general welfare visit, through that mechanism as safe and well. However, what we have been involved in is delivering additional activities. So there was an agreement between the National Fire Chiefs Council and the trade unions and the fire brigades nationally, which included us delivering additional activities. So if we can just go back to that previous slide a second. So the additional activities that we deliver include, and this is I think where the self-neglect potentially comes in and where we're starting to spot issues, is around food parcel deliveries and around no contact letters. So what some authorities have been doing is obviously they're writing out to people to advise them of how to receive support while they're in lockdown. However, what we're finding is that a lot of people aren't taking that up. And even now, 12 weeks down the line, we're still seeing people who have had no support whatsoever. We're going to deliver things, we deliver letters and there's no answer, and neighbours are coming out and kind of expressing concern about people not kind of looking after their own basic needs, and we're not sure whether that. I think part of that is down to just not knowing where to get the support and struggling to get in touch with the right people. But also there is some deterioration in people's mental health, which is meaning that they're almost not able to get over some of these hurdles. So moving on to the next slide, in terms of the trends and themes that we're seeing at the moment. So there's one of the biggest themes is around isolation and mental health issues. We're seeing sort of people's mental health decline the longer they go without having having access to the usual support networks and social networks and all of those sorts of things. We're coming across people who are managing without medication and managing without all the basic supplies because, as I say, they're struggling to get in touch with the right people, or they've tried and not been able to get a response, things like that. We're seeing an increase in alcohol use and substance use. So some we're sort of seeing a lot of smaller fires caused by those sorts of things, and going into properties where really there's been no kind of agency involvement, where perhaps there ought to have been, but people are not recognising their own need for the support, if you like, until much later down the line, by which point it's got to a bigger issue. We're seeing quite a few outdoor fires, as I've mentioned previously. And smoking fires is a key one. So that's been a really big, prior to the pandemic, that's been a really big issue. But I think it's on the increase. So on that slide, that's just one example, and this is the sort of thing we're coming across on a daily basis, but that's just one example of the sorts of comments that have come back from the volunteers who are going out delivering some of the additional activities, is that people are really quite in need of support, but are either not aware of where to go or have sort of given up and not almost fighting for that support that they need, which is a concern, particularly with people who hoard, or people who are in further down the line with self-neglect, who we know will avoid services anyway. And the concern is that we're going to get to a point where we're sort of, we're finding more and more of these people, and that a lot of what we're seeing at the moment is only scratching at the surface, because there's going to be also a lot of people who are good at sort of hiding it. So next slide then, looking forward, we do anticipate an increase in demand, both for safe and well-being, for emergency response, and for complex needs officers, because of the way that some people's situations are deteriorating. Early intervention is really key for us. So the more people we can get out to see, and even if there's not a specific reason, we're more than happy to go and do, or at least deliver remote safe and well visits, just to kind of get a bit of reassurance that people have got working smoke alarms and are aware and are taking care and have got the right support in place, really. We're anticipating, as Seanna touched on, there's going to need to be a lot more of the sort of multi-agency response to these sorts of cases, and that we're going to need to sort of work a lot more smartly moving forward to make sure that all of the right agencies are involved at the right times, and that we're all more aware of what each other are doing. And I think that's one of the key advantages of the self-neglect pathway that we've got in Walsall, is that gives us a really kind of straightforward mechanism to do that. And then voluntary and community sector engagement. It seems to be that the voluntary sector support services are the ones who are most likely to come across people who are self-neglecting at the moment. They are the ones who are going out and who are, delivering activity packs, keeping in touch with people. So we're doing a lot of work around trying to raise awareness across those sectors about the importance of kind of referring to us and trying to manage fire risk on top of all of the, because it's not the most immediate need in a lot of people's. It is something that kind of is in the background. So the final slide, I've just put some details on there about how to refer. As I say, most of you will already have our referral forms and so on, and there are just links there to the various options. The telephone lines are still running, and the contact centre staff are working remotely. So if you do have any difficulties getting through on those, either try the website or drop an email in, or you can ring one of us and we can arrange for that referral to be put through. Important that referral IDs are included, so organisations should have a 4-digit referral ID. If you haven't, again, my contact details are on the first slide there, so please do get in touch and we can arrange that for you. And finally, just to build on what I've said here, which was just a whistle-stop tour, really, there's an e-learning package that's available on our website. So again, there's a link to that on the slide, and the enrolment key there is 999. I've no idea whether anybody can still hear me or whether there are any questions.
We all heard you very clearly there here, so thanks for that, Mel, and you did really well under the circumstances, and thank you ever so much. Nothing like throwing our partners into the deep end. There's been very few questions that have come through. There is one here, but I think it's probably more to Seanna, which is asking around, did the government release legislation to make it easier to hold people using the Mental Health Act? So I don't know whether or not this is in light of COVID-19. So the example that they used is just one doctor and an AMPH because of COVID. So I don't know whether or not you can answer that, Seanna.
Yeah, happy to sort of briefly answer that. So essentially, the Coronavirus Act 2020 came into play on the 1st of August. As part of that, there are proposed amendments to the Mental Health Act, but it's really important to note that there needs to be a commencement order for that to be a reality. At this moment in time, that provision within the Coronavirus Act is not in place. So as it stands, it's a proposed amendment that could potentially be available, but it's not. It's not happening right now.
Okay, thank you. Are you still on the line, Mel, with us?
I am, yeah.
Yeah, brilliant. We've just had one come through from somebody saying, working in secondary school, where do your referrals mainly come from for West Midlands Fire Service?
They come, to be honest. Yeah, I mean, it tends to be so children's services, adult services, health professionals, although we're seeing a decline in that, as I say, because I think that obviously their priorities have had to change, quite rightly. Referring in, we get referrals in from support groups. In terms of children and young people, we do take referrals from some schools, although not that many. We do a lot of work with youth groups locally to try and increase awareness there and offer say some well visits through those sorts of mechanisms. But yeah, we're more than happy to take them from anybody and everybody.
Okay, thank you very much for that. Right, thank you very much, Mel. If we can now try and contact Sharon Latham, who is from Dudley and Walsall Mental Health. So once again, we're going to try and dial in so Sharon can join us. She's waiting for our call. If you do have any questions or queries or comments, please make sure you do pop them in the comment box, and we will try and get to them either while we're dialing people in or at the end.
Hello.
Hi Sharon, is that you?
It is, yes.
Hi Sharon, thank you very much. Obviously you're aware that we're having lots of technical difficulties. We can see your presentation in front of us. It's just going a bit mad at the moment, going a bit far. So if you can just, as you would had you have been actually on the webinar, kind of just talk through, and we'll move your presentation on as we go. Is that okay?
That's absolutely fine. Just to let
Thank
you know
you,
that
Sharon.
from here it's telling me the event hasn't started.
Oh right, you might
So,
be in a different one now, because we've sent you quite a lot of links through, haven't we, to try and get you on.
No problem. Right, obviously I'll introduce myself to start with. So I'm Sharon Latham, and I'm the head of safeguarding for what was Dudley and Walsall Mental Health. However, as I'm sure you can see from the first slide, on the 1st of April, Dudley and Walsall Mental Health merged with Black Country Partnership, and we are now Black Country Healthcare. So for those of you who are working in Walsall, you will see a change in logo. You should see a wider provision, because we now offer the adult and older adult mental health services, which Dudley and Walsall did, CAMS, which Dudley and Walsall did, and the specialist learning disability services, which were previously Black Country Partnership. So when you see that logo, it's the same people. Moving on, COVID-19 has obviously caused quite a lot of change. Change in the way that we're working, and change in the way the things that we see. So what I'm going to do is just quickly run through what we're seeing now, how we're working now, and what we can do now for you. So from tumbleweed to tsunami. Our first couple of weeks in COVID, we saw very few referrals for adults or for children. We made very few referrals for adults or for children because we weren't seeing what was out there. We weren't getting our usual level of contact. That didn't last. Within 2 to 3 weeks, they started to climb, both for adults and for children. And although we're not quite at the levels we are expecting, we are slightly higher than we would have been normally at this time of the year. And what we are seeing, the acuity, the severity is quite high. We are seeing far more people who, I suppose, who are poorly, who are accessing services maybe a little bit later than they would have done normally. However, now they are accessing services, and we're seeing the whole range of not only the mental health problems, but also the social concerns. We're seeing what we expected to see. We're seeing what the news told us we were going to see, what the briefings told us we were going to see. So domestic abuse, we are seeing quite high levels of that. We are seeing, children who would normally be in school, who would be supervised, who would have other people having oversight. We're now seeing a higher level of potential neglect, and we're seeing quite a lot of high anxiety related to COVID for people who didn't attend to see us because they were concerned on any hospital attendance and admission. But what we're also finding now is reports of self-neglect and of hoarding. Now, the next 3 slides, this isn't a Walsall case, this is a Dudley case. But as you can see from the date on the photographs that hopefully you're seeing now, these photographs were taken on the 27th of May. The person who lives in this property has never been known to services, never been known to mental health services, had some contact with adult social care, but a very low level. Independent gentleman, lived in own property in a nice residential street. Neighbours are solicitors and professional people who are out at work all day. They haven't noticed, you know, this person and how their home is until all of a sudden everybody starts to work from home. When the neighbours were at home, they began to notice behaviours of their other neighbours, particularly the person in this property. And they did become concerned about how and what was happening there. They also became concerned at the impact on themselves. They became concerned that if what they were seeing on the outside of the property, which was nothing like what they were seeing on the inside of the property, what was happening inside, was there any form of infestation, was there any, you know, were there rats? When we actually got into this property, we discovered that there were no utilities, there was no gas, no electric, no running water. There'd been a fire 2 to 3 years ago. Since then, he'd cleaned out the fire. There was no, other than some smoke damage, no evidence of that fire, but all of the utilities had been disconnected then and had never been reconnected. He'd never requested to have them reconnected. He was using public toilets and public spaces. This gentleman was immaculate. To outside view, absolutely immaculate. He was clean, he was well presented, clothing absolutely appropriate, no evidence of what you would consider to be self-neglect. So had COVID not happened, we would potentially not have known about this. So we have had a lot of changes in what we're seeing, and this gentleman is now very, very slowly receiving the support that he needs. We have had to change our working practices as well. So, you know, those of you that know our service know what we have, know what we do. We had to change what we were doing. So some of our support services, you know, our employment services, some of our lower level assessment services, they were suspended, and the staff from those services were redeployed to what we would term as frontline working. So they were working on the wards and in active community teams. All of our secondary services have continued. We've had to be a little bit creative, as I'm sure all of us have. You know, we're utilising a lot more in telephone calls and video calls. We are sending out different types of support that people can access either online or they can access themselves without having to be reliant on us. However, those people that have still needed face-to-face appointments, those people have had face-to-face appointments, right from our little ones in CAMS to our young people, through adult services and into our older adult services. We have continued to offer appointments face-to-face if that was what was needed. Everybody has been risk assessed, so we have still been working. We were all quite bemused when we suddenly heard that the Health Secretary announced that mental health services were recommencing and opening up again, because they forgot to tell us we were shut in the first place. So in addition to those services that we've always run, we have also added in a mental health support line. Now, the mental health support line is for people who aren't open to our services. Somebody who is already open, who already has a CPN or a consultant or any form of support worker from our services, you should contact the same way that you would usually contact. If you are not open, if your service user, whoever, is not open to our services but is experiencing increased distress, anxiety, concern, we are seeing a lot of people whose worries around COVID are far higher than you would consider that maybe they need to be, or that the worry around COVID has increased other symptoms that somebody's experiencing. So we have the helpline, which hopefully you can all see on your screen. You can find that online. If you click onto it, if you still search Dudley and Walsall Mental Health or Black Country Healthcare or 24/7 Black Country Support, you will get that phone line. And if you live in Walsall, you need to press 2 when you get through, and that will get you through to a practitioner that knows Walsall. We have different practitioners from different arms of the service that know what is on offer for the area that you live in. So the one that answers for Dudley and Walsall, option 2, knows what services are available, knows where you should be signposted to and what's on offer. So last slide for me, and I have no idea when I can't see anybody or hear anybody if I'm talking too fast or if you've all gone to sleep or if you've all left. For those of you that already know us or that need to access, our IAP service is still running, our Healthy Minds service still running. You can access free online CBT via the Silver Cloud platform, or you can go through all of the normal routes, which is your GP for primary and secondary care if you're not open to services. If there's a massive concern, as I'm sure Seanna mentioned right at the beginning when I couldn't hear her, Mental Health Act assessments are still ongoing. They would be requested in the normal way. GP next to kin can request those, and your usual assessments can all be accessed in exactly the same way. So despite COVID and despite our brand new name and new branding, we are still here and we are still offering the services that need to be offered. I'd like to say if there are any questions, but I can't see them or hear them, so I'm going to leave it there.
Thank you, Sharon, for that. That was really useful from all three of you. Unfortunately, we can't get hold of Connie from WHG, but we will see if we can get some type of recording or something from her and send that out to you at a later date. We haven't had many questions come through. One that we have, which I think might be Seanna as well to answer this one, is that if someone is referred via the self-neglect pathway but refuses to engage, what would be the best course of action?
Good question, and clearly it is a common challenge. Essentially, the purpose of the panel is to have a multi-agency discussion and to come up with some recommendations and ways of working jointly. What the research says, which we haven't got time to go into in terms of working with people who self-neglect, is the importance of a trusted relationship. Now, that may be a neighbour, maybe a friend, maybe someone in the fire service, one of the complex needs officers, maybe a CPN. So it's who has that trusted relationship. And we recognise that it's going to take time to build that trust. So I guess the message is that there is not an option to do nothing. But we would continue in terms of the partnership and whoever may be the key person to continue to try and invest in that relationship and build those bridges to try and kind of minimise that risk and get people the support that they might need to improve their well-being. So hopefully that helps a bit, but yeah, it will very much be on a case-by-case basis.
That's lovely, thank you. We haven't had any other questions through. If people do have any questions, please pop them in the box, and Seanna, because she's the only one left online, I'm sure, would be happy to answer them for you. Otherwise, you all have got my email address, so you can have a look. If there is anything that following this that you can contact me directly, and I can pass that query on to the relevant person. As you can see on your screen now, there is the Safeguarding Partnership website address. All the information that we've spoken about today, referral forms, links, things like that, can be found on there, along with any additional training as well. This webinar will be put on there. I've had a few emails off people saying that they had to leave at 2 o'clock because they had other meetings to go into, but it will be available on the website. Somebody else asked whether or not they could share the presentation with colleagues. Yes, please do. We'll send you through the slides following this webinar, and you'll be able to access it, so people will be able to hear it as well and hear from the presenters as well. Just like to apologise again for all the IT issues that we've had today. It's one of those things where all the best laid plans, so we've done practice ones of these, we've had pre-meets, but on the day it just let us down a little bit, and can only apologise for that. But thank you all for sticking with us. We still have over 50 attendees, so obviously people have been able to hear us. We will be sending through an evaluation of this webinar. If you could, it's just literally 5 minutes. We'll send it through as a link. It'll take 5 minutes to complete, but it's just going to help shape future webinars. So if you've got anything that you would like to hear about from other professionals across the partnership, if there's any specific things that you'd like to actually come on a webinar, please let me know, and we can look at how we can set that up. So we have got future ones planned. All of that can be found on the Safeguarding Partnership website. If you go into e-learning, there's all e-learning on there, and there are future webinars. So also a big thank you to all our presenters today under quite stressful circumstances. In the kind of late hour that we were going live, it all kind of went to pot. So thank you very much to Seanna, to Mel, to Sharon, and to Kerry, who's been in the background doing all this as well. So thank you very much for joining us. We hope that you can take something away from today's webinar, and we hope to see you in any future ones that we are going to have. Thank you.